911 Global Meds Disclaimer. This video and any contents herein are posted on this YouTube channel of 911 Globe Meds for informational and educational purposes only. Please see the detailed video contents disclaimer and the copyright disclaimer in the text section below.
KEYNOTE-100 trial's been going on for a number of years now. We're presenting the final results. I presented the final results at ASCO 2020. So this is a trial of single-agent pembrolizumab in 376 patients with recurrent ovarian cancer. Women were divided into two groups, so Group A or Group B. Group A were patients who were less heavily pretreated. They had to have at least one prior line of treatment and up to 3 prior lines, with a platinum or treatment-free interval of at least 3 months from their prior treatment and up to 12 months maximum. Most of the patients went into cohort A. For cohort B, this was a more heavily pretreated patient population. They had to have received at least 4 prior lines of treatment, up to 6. And again, a platinum-free or treatment-free interval of at least 3 months from the prior treatment. So they had to have some response or some benefit from their prior therapy, but there was no upper limit in terms of the treatment or platinum-free interval. When patients were first enrolled, especially into cohort A, there was a training set, and that was the first 100 patients that served as a training set for determining PD-L1 expression cutoff levels. And the PD-L1 expression was measured by the combined positive score, which is not just the number of tumor cells or cancer cells that are PD-L1 positive, but also macrophages and lymphocytes, et cetera, other cells within the tumor microenvironment that might be PD-L1 positive, divided by the number of tumor cells times 100. That served as the CPS score. And the cutoff points were 1 and then 10. So the overall primary endpoint or main endpoint of the study was RECIST, looking at version 1.1 by cohort. So RECIST response rate, overall response rate by cohort A versus B, and then by PD-L1 expression levels as measured by CPS score, which I mentioned before. So what we saw was and all women were enrolled, 376 patients. Most of them had high-grade serous. About 75% of patients had high-grade serous carcinomas. Some patients had endometrioid tumor, some low-grade serous, some clear cell, but they were each significantly less than 10%. Patients had to have an ECOG performance status of 0 or 1, no prior bowel obstruction within at least 3 months prior, and mucinous histology was excluded. And what we found was that for patients in cohort A versus B, there's really no significant difference amongst the response rate. Response rates are around 8 to 9%. And those responses were irrespective of the number of prior lines of treatment that the patients received. So if they had received 6 or they had received 1, there really was no difference, which is in contradistinction to patients receiving chemotherapy. So patients receiving chemotherapy for platinum-resistant ovarian cancer, as they receive treatment, the response rates lessen with time. And we really did not appear to see that with single-agent pembrolizumab in KEYNOTE-100. When we looked at the CPS score, so patients who had a CPS score of 10 or higher tended to have increased response rates. And we saw a response rate that actually approached around 18% for patients who had a combined score of 10 or higher. So CPS score appeared to have a prediction for increased response rate, and clear cell histology also seemed to have was a predictor for higher response rate. And that's been seen in other single-agent IO trials as well. With regards to toxicities, both just overall toxicities as well as immune-related toxicities, there were no differences in toxicities versus other single-agent pembrolizumab trials. So most of the toxicities were grade 1 or 2 and were fatigue, some nausea, diarrhea, etc. For immune-related toxicities, the most common were related to the thyroid gland, either hypothyroidism or hyperthyroidism. Most of these were grade 1 or 2. Other toxicities were seen, such as colitis. There were some grade 3 or higher toxicities here. And we also saw skin toxicities. One patient developed Stevens-Johnson syndrome and actually had a grade 5 toxicity. The other grade 5 toxicity out of 376 patients was hypoaldosteronism. So there were 2 deaths related to treatment. But overall, aside from those 2 patients, most of the toxicities were, grade 1 or 2. And again, as I mentioned, not dissimilar to other single-agent pembrolizumab trials. So I think overall, what we've seen here is, response rate of, a little below 10%, and not dissimilar to other single-agent immunotherapy trials for patients with recurrent ovarian cancer. Those response rates were higher in patients whose tumors were, significantly PD-L1 positive, so had a combined positive score of 10 or higher, where the response rates were around 18%. And the responses were seen, regardless of how heavily the patient was pretreated, and also, regardless of the level of platinum sensitivity. So it didn't seem to matter if the patient had platinum refractory or platinum resistant cancer, even platinum sensitive cancer. So those were the overall kind of high level results of the final results of KEYNOTE-100.